The modified Thomas test. Now we're going to have a look at the hips again and assess its capacity in flexion and extension, as well as identify any tightnesses in its lateral structures. The main muscles that we're going to be testing are the iliopsoas, so these are also known as the hip flexor muscle group, the rectus femoris, which is a quadricep muscle, but it's also a hip flexor as it crosses the hip joint, and the tensor fascia lata, or the TFL, which makes up part of the lateral quad. Now, all of these soft tissue structures can contribute to hip mobility issues. And like the hip rotators, the hip flexors, when tight, will have an impact either upstream or downstream of the hips, causing compensatory movement patterns and therefore dysfunctional movement patterns. And one of the ways that we develop tight hips is through our sedentary lifestyle of excessive sitting. This causes the hip muscles to shorten up and can cause the knees and the lower back to become unstable, putting us at risk of injury and contributing to pain. Now, in addition, tight hip flexors can also prevent us from achieving a good-looking full-depth squat. What tight hip flexors or quads could I have presented as in the squat test? So if you perform the squat test and presented with any of the following issues, tight hip flexors or tight quadriceps could be the problem. We have hip pain. This is usually at the front of the hip, and it usually comes on when achieving the full depth, right at the bottom. Knee pain, usually around the top of the kneecap here where the quadricep inserts on the kneecap. This is brought on by squatting. A weight shift to one side of the body, twisting of the hips to one side, or a full depth squat could not be achieved. So what tight lateral hip or TFL could have presented as in the squat test? So if you perform the squat test and presented with any of the following issues, tight TFL or a tight TFLs could be the problem. We have knee pain. This is lateral at the outside of the kneecap down here, or pain around the outside of the hip at the top of the hip just here, or it could be down the whole lateral side of the hip. So the setup for the test, you're going to need to find a table or bench, and this is somewhere that you can dangle your legs from freely. You'll need to film the test from one side to start with, and then from the front. So you have to film it from two different angles. The test itself, set your camera up to film from the left side first. So sit with the waistband of your underpants right on the edge of the table, and then lie back onto your back and grab both of your knees, pull them towards your chest and hold in there tightly. Now lower your left leg down while keeping your right leg pulled in tight. Ensure that your lower back is nice and flat and not arching off the table. Let the left leg dangle and hold this position for 5 seconds. Now set your camera up to film from the right side and perform this test with the right leg. Lastly, set your camera up to film from the front and perform both tests again on both the left and the right leg. So what to look for and do. So the first observation is the quadricep test. When looking at the videos filmed from the side, observe what is happening at the knee joint. The shin bone should be hanging straight down and creating a 90-degree angle at the knee joint. However, if the knee is hanging in front, if the heel is hanging in front of the knee, we conclude that you have tight quadricep muscles. This muscle is also known as the rectus femoris, and a lot of the time when we see it tight, it's contributing to general knee pain. If this is the case for you, please refer to the hip mobility quadricep exercises in the corrective exercise section of the course. Now the second observation, the iliopsoas test. So looking at the videos filmed from the side still, if the knee is positioned above the hip or the hamstring does not touch the bench that you're lying on, we can safely say that you have tight hip flexors or tight iliopsoas. If this is the case, please refer to the hip mobility hip flexor exercises in the corrective exercise section of this course. And the third observation from this test, the TFL test. Now looking at the videos filmed from the front, we're looking to see if any hip abduction is being created. So hip abduction will look like the leg is being pulled to the outside of the body. So if we're testing the right leg, the leg would pull to the right with its left to dangle. This indicates that you have short or tight TFL muscles. This is common with people who experience lateral pain in the quadriceps and pain around their lateral kneecap or the outside of the kneecap. Now, if this is the case for you, please refer to the hip mobility TFL exercises in the corrective exercise section of this course.